Hi, I'm Danica Velasco, and this is my appendicular skeleton. So we're going to start with the pectoral girdle, which includes the clavicle as well as the scapula back here. The pectoral girdle is the shoulder upper extremity, and it's very light and it allows for great mobility. We're going to start with the clavicle, which is this portion right here. It's also known as the collarbone. It's very weak and slender, and it's easily breakable. The sternal end is right here, and the acromial end is right here. The scapula is this part right here. There's a thin triangular bone, and it articulates with the clavicle and the humerus. The coracoid process is this area in here, and you can also see the spiny part right here. It helps anchor the biceps of the arm. The subscapular fascia is this portion right here. The glenoid cavity is this portion right here. It articulates with the humerus, which helps form the shoulder joint. The spine is this right here. It's it flows parallel along the scapula. The acromion is the end of the spine, which is right here, and the supraspinous fossa is this portion up here. And then we have the infraspinous fossa, which is this lower region right here. The sternoclavicular joint is right here. It connects to the sternum. I'm pointing right there. And then the acromioclavicular joint, which is right here. Now we're going to move to the arm. Okay. We have the humerus, which is this portion right here. It is the longest bone of the upper limb. Longest bone of the upper limb, the humerus. We have the head portion, which is right here. And then we have the greater tubercle, which is this portion right here. And then we have, this is the lesser tubercle, this is the greater tubercle. And this groove, you can see it, this groove right here is the sulcus, and then these three form the site of attachment of the rotator cuff. Then we have the deltoid tuberosity, which is along here. Then we have the medial epicondyle, which will be right here, the medial epicondyle, and then we have the lateral epicondyle, which is this portion right here, and then this depression right here is the coronoid fossa. Then we move on to the capitellum, which is this right here, and it radiates with the radius, or articulates, with the radius. And then on this side, right here, we have the trochlea. And then this side, yes, is the olecranon fascia, this depression right here. Okay, now we're going to move on to the forearm. The ulna is the longer of the two bones, which is this right here. We have the olecranon, which is this. It's the elbow. And then we have the coronoid process, which is this area right here. Then we have the styloid process, which is at the distal end, and it's right here. And now we move on to the radius, which is thin, and it's opposite of the ulna. And we have the head, which is up here. And then we have the radial tuberosity, which is right here. And then we also have the styloid process at the distal end, which is right here. And now that allows us to move on to the carpus. So the carpus is also known as the wrist, which is, let me make sure you can see that, which is this portion right here. Yeah, that's better. Okay, which is this portion right here. And so we have the carpus, like I said, which is the wrist. And then we go up here, which is the scaphoid. It's the most commonly broken bone, right here. And then next to the scaphoid, we have the lunae, which is right here. And together, these form the wrist joint with the radius. Next to the lunate, we have the triquetrum, which is this part right here. And then, if you flip this up, we have the pisiform, which is this bone right here, this protruding bone. You can see it. And then now we're going to move to the distal row, which is right here. And we're going to start with the trapezium. And this forms a joint with the pollex, which is the thumb. Next to the trapezium, we have the trapezoid, which is right here. And then we have the capitate. And then next to the capitate, we have the hamitate, which is a hook-like joint. Yes, right there. Okay. Now we move on to the pelvic girdle. The pelvic girdle is the attachment. This is the, make sure it's in there. This is the pelvic girdle, this area right here. It's the attachment for the lower extremities, and it also protects the viscera. We have the coxal bones, which are these right here. And after the coxal bones, we have the acetabellum, which is this area right here. And it's where the femur attaches to the pelvic girdle. Then we have the pubic symphysis, which is this joint right here, and it connects both sides. Then we have the obturcular foramen, which is this area right here, and it allows for nerves and blood vessels to pass through. After that, we have the iliac crest, which is this portion right here on both sides. It's the site of muscle attachment. And then we have the anterior superior iliac spine, which is this part right here. It's very blunt and bony and can be seen in people who are people who are thin. It protrudes from the skin. Then we have the iliac fascia, which is this area and this area, and it's also the site for muscle attachment as well as gluteal muscle attachment. In here, we have the greater, let me see right here, this area. We have the greater sciatic notch, which is where the sciatic nerve passes from the pelvis into the leg. And then we have the ischial spine, which is this portion right here. And then you could see the dorsal part of it, which is right there. And then we have the ischial tuberosity, which is right here. And when we sit down, this is where all of our weight goes. It's the strongest part of the hip bone. And that leads us to the femur. The femur is the longest and strongest bone of the thigh, and you can't feel it because of all the muscles that are surrounding it. The head is very ball-like, which is up here. We have the greater trochanter, which is this portion right here. And then we have the lesser trochanter, which is this portion right here. And then we have the adductor tubercle, which is this area right here. Then we have the medial epicondyle, which is going to be this part right here. And then we have the lateral epicondyle, which is going to be right here. This is the site of muscle attachment to the flank condyle superiorly. Then we have the patella, which is right here. It's a sesamoid bone, and it protects the knee joint. This is the patella. And then we have the medial condyle, which is right here, and the lateral condyle, which is right here. And then we have, also I forgot to mention, for the greater trochanter and the lesser trochanter, these are attachment sites for the thigh and gluteal muscles. This part and this part right here. Okay, so, and I said this is the medial condyle and this is the lateral condyle. And that takes us to the tibia, which is also known as our shin bone, which is right here. This bears the weight of the body. The medial condyles are right here. The lateral condyles would be right here. Down right there. The tibial tuberosity is going to be right here in the middle. The medial malleus is down here, this portion right here, and it forms the ankle bone, and that's very easily palpable. The proximal tibofibular joints are going to be right here, and the distal tibiofibular joints will be right here. And now we move on to the fibula, which is this bone right here. It's very thin and it's very easily fractured. We have the head portion, which is right here, and then we have the lateral malleus, which is going to be right here. And the lateral malleus is at the distal end of the fibula, and it articulates with the talus. The tarsus, which is the ankle as a whole, is all this, and then we have the talus, which is the talus. Can't see it. The talus, well, which would be this bone up here, and then that articulates with the tibia and the fibula, and then we have the calcaneus, which is the heel portion right here. There we go. Okay. And then this would be the talus right here. There we go. This would be the talus. And then we have the cuboid, which is going to be right here, this bone right here. And then after the cuboid, we have the navicular, which is this longer bone right here. And then after that, we have the medial bone, which is right here. And after the medial, we have the intermediate, which is right here. And then after the intermediate, we have the lateral, which is right here. And then we have the metatarsals, which are digits 1 through 5, this being 1, 2, 3, 4, 5. And then we have the phalanges, which are this portion. And then we have the hallux, which is the big toe, and it only has 2 points. And digits 2 through 5 have 3 points. And that is it. Thanks.